Apixaban para prevenir el tromboembolismo venoso en pacientes con cáncer. Pacientes con cáncer activo tienen un mayor riesgo de tromboembolismo que resulta en morbilidad y mortalidad sustanciales. Aunque la tromboprofilaxis parenteral puede reducir el riesgo de tromboembolismo venoso entre pacientes ambulatorios que reciben quimioterapia, no se recomienda de forma rutinaria en las guías de práctica porque la reducción absoluta del riesgo es modesta y la tromboprofilaxis parental se asocia con un riesgo mayor de hemorragia mayor, un alto costo y el inconveniente de inyecciones diarias.
Patients with cancer have an increased risk of venous thromboembolism, but parenteral thromboprophylaxis is not routinely recommended in practice guidelines because the absolute risk reduction is modest, and parenteral thromboprophylaxis is associated with an increased risk of major bleeding, as well as the inconvenience of daily injections. Could a direct oral anticoagulant such as Apixaban, used as a thromboprophylactic agent in patients with cancer, offer advantages over parenteral agents, particularly with regard to convenience? The randomized placebo-controlled double-blind AVERT trial included ambulatory patients with cancer who were at intermediate to high risk for venous thromboembolism with a Karana score of 2 or more. The Karana score has been validated to identify patients with cancer who are at elevated risk for thromboembolism. The trial patients were randomized to Apixaban for thromboprophylaxis before chemotherapy or to placebo before chemotherapy. The primary outcome was objectively documented venous thromboembolism over a period of 180 days. In a modified intention-to-treat analysis, venous thromboembolism occurred in 4.2% of the 288 patients in the Apixaban group and 10.2% of the 275 patients in the placebo group. The number needed to treat to prevent venous thromboembolism was 17. The main safety outcome was major bleeding. Major bleeding occurred in 10 patients in the Apixaban group and 5 patients in the placebo group. The authors conclude that Apixaban at the initiation of chemotherapy resulted in significantly lower rates of venous thromboembolism than did placebo among intermediate to high-risk ambulatory patients with cancer. The rate of major bleeding episodes was higher with Apixaban than with placebo. Full trial results are available at nejm.org.
Apixaban es un potente inhibidor oral reversible, directo y altamente selectivo del factor XA. No requiere antitrombina 3 para la actividad antitrombótica. Apixaban inhibe el factor XA libre y ligado al coágulo y la actividad prototrombinasa. Apixaban no tiene efectos directos sobre la agregación plaquetaria, sino que inhibe directamente la agregación plaquetaria inducida por la trombina. Al inhibir el factor XA, Apixaban previene tanto de la formación de trombina como la formación de trombos. Los ensayos preclínicos de Apixaban en modelos animales demostraron eficacia trombótica en la prevención de trombosis arterial y venosa a dosis que conservaron la homeostasis. Ventajas y desventajas. Ventajas. El uso de anticoagulantes orales directos como agentes tromboprofilácticos en pacientes con cáncer puede ofrecer importantes ventajas sobre los agentes parenterales, incluida la vía de administración, la conveniencia y el costo. Desventajas. Los pacientes con cáncer activo tienen mayor riesgo de tromboembolismo venoso, lo que resulta en una importante morbilidad, mortalidad y gastos de atención médica. Entre las causas más comunes reportadas tenemos los factores de riesgo para el desarrollo de la trombosis venosa. Tienen la trombofilia heredada, la mutación del factor 5 de Leiden, mutación de protrombina G202110A, deficiencia de proteína S, deficiencia de proteína C y deficiencia de antitrombina AT.
Some of the things that I think are going to be really exciting about the rollout of these guidelines are that since the last guidelines were published, we now have 4 new drugs that are available on the market for people to prescribe, and we don't have any guideline information about how to use those. And so one of the things that was really exciting for our panel is that we are able to dig in and try to make some recommendations about how to use those drugs in the treatment of people with venous thromboembolic disease. And it was really exciting, but it was also challenging because the drugs are new enough that a lot of the information about questions that people are grappling with, there might not have been as much evidence, but the really great thing is in the room in the panel discussing this were the experts and the people that really have their finger on the pulse of what's going on out there clinically. A novel thing about these guidelines is that the plan is to continually update them as much as possible in real time. And so I think our panel will get the opportunity to add additional information, and as new drugs come onto the market, there's many that are in the pipeline right now. We'll be able to add to the recommendations that we've made and continue to inform people about the optimal use of anticoagulant drugs.
En Ecuador, las estadísticas son escasas, sin embargo, se estima una incidencia de 1 por cada 1000 habitantes. El tromboembolismo venoso afecta a la población mayor de 40 años, siendo relación de 1.3 a 1 en hombres y mujeres respectivamente. Las cifras más actuales que se reportan en Ecuador mediante el INEC son del 2004, el cual muestra 224 casos de tromboembolismo a nivel nacional para una población de 12.810 millones de habitantes, uno por cada 51.187.5 habitantes, 142 mujeres, lo cual representa el 73.4% y 82 hombres, que representan el 36.6%. Fallecieron 29 pacientes, son el 12.95%, 12 hombres, 41.4% y 17 mujeres, que es el 58.6%. En Ecuador se estima una incidencia de 1 a cada 1000 habitantes. 2 de estas cifras nos indican la importancia del conocimiento y prevención de esta patología. Por este motivo se realizó un estudio de casos y controles múltiples, en el que se incluyó una muestra de 54 pacientes que realizaron una cirugía programada, que representaron los siguientes factores de riesgo: edad mayor a 40 años, uso de anticonceptivos, obesidad, inmovilidad, estados postoperatorios, cirugía mayor, cirugía prolongada, tabaquismo, insuficiencia venosa de miembros inferiores, hospitalización, catéter central y marcapasos. El presente estudio tuvo un costo aproximadamente de $400.284 y se realizó en el periodo de mayo a junio del 2014. Conclusión. La terapia Apixaban resultó una tasa significante más baja del tromboembolismo venoso que el placebo entre los pacientes ambulatorios con cáncer de riesgo intermedio a alto que estaban comenzando la quimioterapia. La tasa de episodios hemorrágicos mayores fue mayor con Apixaban que con placebo.
People living with cancer need to know the signs and symptoms of blood clots, also known as venous thrombosis. Blood clots are a common problem for people living with cancer. About 1 in 200 cancer patients develop a blood clot, though the risk of getting a blood clot is not the same in all people with cancer. For example, the risk is higher if the cancer is actively growing, if it is spread to multiple areas, if the person is receiving chemotherapy or has surgery, or if the person has other medical conditions such as infections. Venous thrombosis can develop in the deep veins of the legs, a condition called deep vein thrombosis, or DVT for short, or it can occur in the blood vessels of the lungs, a condition called pulmonary embolism, or PE for short. Sometimes blood clots can occur in the arms, especially if a catheter is in place for giving chemotherapy or taking blood. When DVT occurs, the clot causes the flow of blood returning from the leg back to the heart to slow down or back up. This causes congestion, sort of like a traffic jam. As it gets pulled down by gravity, fluid collects in the ankle or calf. This can cause swelling of the leg. You might also get cramping in the calf, redness or discoloration of the leg, or a sense of heaviness in the leg. If the DVT is in the arm, similar symptoms occur. People may complain of aching in the shoulder or neck and might notice that the veins on the back of their hands pop out. If the DVT occurs around a catheter, the catheter might not work properly so that it becomes difficult to draw blood from it or inject fluid or drugs into it. If you have any of these symptoms, you should tell your doctor. When PE occurs, the clot blocks blood flow in the lungs. This will often cause breathing problems, especially when you're exercising or doing regular day-to-day activities like walking upstairs, carrying groceries, or doing household chores. Some patients may get chest pain. The chest pain can have a sharp stabbing quality that is worse with deep breaths, or it can feel like a pressure on your chest. When a clot is in a larger vessel in the lungs, or there are multiple clots in the lungs, you can feel lightheaded or dizzy. Some people also report feeling anxious. If you get any of these symptoms, it is important to have someone take you to the emergency department or call 911 if you are by yourself. PE is a medical emergency because it can be life-threatening. You must not ignore these symptoms because even if they are not from PE, they can be signs of other serious conditions, like a heart attack. So it is important to get medical help right away. Treatment is usually very effective and can save lives. The symptoms of blood clots can sometimes be subtle and can be confused with other conditions that cause similar symptoms. So if you have these symptoms, it is important to see your doctor quickly to have special tests done to check if you have developed a blood clot. What are the treatments for thrombosis? For people living with cancer, the recommended treatment for venous thrombosis is an injectable blood thinner called low molecular weight heparin. This is a drug that is given by a small needle that is inserted under the skin, very much like the way insulin is given in people with diabetes. The injection is usually given once a day. The dose is based on your weight and how well your kidneys work and needs to be calculated by the doctor. The drug works by stopping blood from clotting quickly. Once you start the treatment, the DVT or PE stops growing and the body can slowly start breaking the clot down. Because this drug slows down blood clotting, one of the risks is that if you have a severe bleed, for example, if you seriously injure yourself, that bleed can be harder to stop. In most people with cancer and thrombosis, the benefit of treatment with blood thinners far outweighs the risk of bleeding. Once you start treatment for a blood clot, you need to continue taking the medication for at least 3 to 6 months. A shorter period of treatment can put you at risk of getting more blood clots. Your doctor will see you a few months after starting this medication to help you make a decision on whether you can stop treatment or whether you need to continue. That decision depends on what's happening with your cancer, if you're still receiving cancer therapy, and how well you've tolerated the injection therapy. If you don't want to use injection therapy, there are other options, but they don't work as well as injections. Warfarin is a pill that has been used as a blood thinner for over 70 years. It is still sometimes used for treating thrombosis in patients with cancer. It is taken by mouth, but it can be high maintenance. Because warfarin interacts with some types of food and some types of drugs, including chemotherapy, people need different doses at different times. The only way to make sure the correct dose is being used for each person is to check their blood levels regularly. This may be hard to manage if you are living with cancer. There are newer pills available that work like warfarin that don't require dose changes or regular blood work, but since they have not been fully tested in patients with cancer, they are not yet recommended. If you do have cancer and get a blood clot, your doctor will be able to help you make the best treatment choice for you.